So Dr. Tammi decided to become a geriatrician, essentially, right? You got your doctorate in it, and now most of your practice, if not all of it, right, is in hospice, end-of-life care. Why? Like, I know why I do it. Why did you choose to go down that path? And, what drives you? Because you do your care with so much passion and so much heart. And as everyone who listens to this podcast knows, this one is really about spirituality. And that's what I connect with Dr. Tammi about, is she does it thinking about the spirit, thinking about the whole, right? Like we talk about holistic care. You really do. You deliver holistic care, from the medicine to the nursing to the medications to that touch, that moment where you're just there for us. So why and what drives you, Dr. Tammi?
So why do I do this? Speaking on the spiritual piece, I believe that this is a gift from God. It was bestowed upon me to do this work. I couldn't have made this up. It's very hard work. It's very challenging, but it is so incredibly rewarding. So I've been a nurse practitioner, geriatric nurse practitioner from UCLA since 2003. I've been a registered nurse since 1997. So what is that, like 20 plus years? It's been a while.
Yeah.
So geriatrics has always been my focus, because when I was in nursing school, we have to go through all the different specialties, and I did labor and delivery and pediatrics, and cried to my instructor through the first clinic. I'm like, please don't make me go back there. And so I was allowed to go to the emergency room, and then that's where I sort of knew that I wanted to take care of adults. But it was probably my first year of being a registered nurse that I realized I love old people. They do the darndest things. They say the darndest things. They're the best. And so ever since then, I've been taking care of old people, geriatrics. And so I believe that because this is a special gift that I have, when I'm taking care of someone who is transitioning, it's not just that person, it's the whole family unit. And so when someone is transitioning and they're in that hallway, it's very important to recognize their physical issues as far as needing medications for symptom management. But in my opinion, it is first and foremost important to be able to assess and identify and treat their spiritual distress. There are a ton of medications I can use to manage shortness of breath, pain. But if you are in a spiritual distress, that really takes a special soul to help you transition through that. And so it's really hard for me to give you a didactic definition of what spiritual distress is, because it's unique to everyone. But my overarching philosophy is, in this body that we have one chance to be born and one chance to die. And it's very important for me that the patients and families that are under our care, that I do my best to make sure that is the most memorable experience in a positive way. We've all heard the horror stories of hospices where someone's symptoms weren't managed, some nurse was mean, they didn't get the diapers that they needed. And you know what happens? What's that saying? That bad news travels further than good news. Yeah. And it's an indelible experience. I mean, we have a case literally right now. I saw one of our patients before I came for this podcast. She's 102 years old.
Wow.
She was square dancing up until the age of like 95, and she started her transition process about 16 hours ago. Her grandson is an ICU registered nurse. He's at the bedside, and daughter's at bedside. And so it's difficult when you are taking care of someone who has a healthcare professional as a loved one, because you're like, they're watching me.
Yeah.
But that's where that gift came in, where I had to take over and say, this is where I take over and help. And so being able to recognize that that particular lady needed some help as far as breathing concerned, and that I needed to pick up the phone and facilitate a conversation with a loved one who she hadn't spoke to, and tell that loved one, like, now is the time to say the words. That's a special gift and a special art, but in my opinion, that's the work that we do in hospice. You have to look at not only the patient, but the family members, because when this lady completes her transition, when she dies, guess who's left over? This grandson, the daughter, that family member, and that's the memory that